Here we are in the emergency room. And what do people think about when they come to the emergency room? They think of cuts and scrapes and accidents and broken bones. One of the most important reasons that kids come to the emergency room is because of psychological scrapes and bumps and broken bones.
Most people are surprised to hear that babies have stroke. We think of stroke as a disease of the elderly, yet the single highest risk time in your life to have a stroke is the day you're born. So stroke is a problem of the newborn. The earlier we intervene, the better the outcomes.
Marlowe had a stroke the day she was born, and the doctors at SickKids diagnosed her very early on, which meant we knew what we were dealing with when it came to her brain development. And as a result, we were able to help her from a very early stage.
In a situation like Marlowe's, we have the opportunity to work with her at an early age, to do assessments, to help understand where her strengths are, if there are any areas of difficulty, and then how to best support them as she enters into school, promote her learning, and just maximize her abilities to the fullest.
What's your favorite of all those things?
Horseback riding.
Do you ever just relax?
No.
So in the MEG, we can see early brain activity, how it develops. We get very accurate measures of brain function, and understanding the brain function allows us to help the children with autism or children born very preterm.
SickKids has a big role to play in the delivery of children's mental health specialist services. Through the Tilink Mental Health Program, we have a very, very far reach. So what this really means is that I or any of my consultants can be here in Toronto and providing child mental health expertise anywhere really across the province of Ontario, anywhere in Nunavut. The exciting thing here is that it really takes mental health service delivery outside the walls of SickKids and really puts us in any community essentially.
The biggest highlight of my day is watching the children's self-confidence soar. This is the only epilepsy classroom that we know of in the world. What we're trying to do in the classroom is provide a transformative learning environment so that these children can thrive. And in order to do that, we have a multidisciplinary staff that can address the children's needs, but we're also using innovative strategies and empirically based interventions in order to enhance students' academic progress, to promote social emotional well-being, and strengthen their self-reliance. One of the critical features of our program is to understand each individual's epilepsy. Epilepsy really manifests differently for each individual, and so in order to understand that, we work closely with their neurologists and with the epilepsy monitoring unit.
Children come into our epilepsy monitoring unit to be evaluated for surgical candidacy. And we actually withdraw their medications to encourage them to have seizures. This is one of the few times when we actually want children to have seizures. They're safe, they're in our care, but we actually need to see seizures while our EEG tests are running so that we can pinpoint the exact area where the seizures are coming from. If we can find that, then that leads us down the path towards epilepsy surgery.
Once we know where the seizure focus is, it's my responsibility then to offer surgery to resect that area of the brain that's abnormal, causing the epilepsy, so that potentially those children can be seizure-free over time.
The social work single session clinic offers families a very quick access to therapy, and it focuses on the immediate problem facing the family. What they need is something to help them figure out how to deal with the issue that's most at hand. And working together, dealing with one issue, is often enough to help them continue their journey.
With centronuclear myopathies, these are a class of diseases that affect children, and the underlying issue is essentially that the muscle doesn't respond to the brain's input. And so you end up with profound muscle weakness. So we're really using zebrafish because their muscle is so similar to our own. Hopefully, we're able to identify drugs that can be translated to the clinic and brought to patients and improve their muscle function as well.
So we're here in the cardiac diagnostic and interventions department. Over the last 6 months, we've been using this MRI scanner not just to image the baby's hearts, but also to image their brains. By understanding the effect of heart disease on the brain, then we might be able to better understand how to protect the brains against the ill effects from heart disease and its treatment.
There. Well, one of the things we're working with is trying to clear a brain, to really see inside the mind and try and understand what's going on. People often ask me about why I'm interested in dementia, and I work at a children's hospital. Isn't young people what we do at SickKids, and isn't it old people who get dementia? And the answer is yes. Well, we think that understanding how the developing brain learns and how an adult brain learns is going to be really key to unlocking the problems with how we forget, as in dementia.
Nursing is really that common thread through the center. So no matter where the child is, whether they're in the emergency department, whether they're in the hospital, whether they're in the clinic, a nurse is there to support the family, to make sure that the care is provided that they need, that they get the education they need, that they get access to the resources they need. So you really try to make that difference for them and really try to be that rock for them during those really difficult times. Many families, when they do go home, if they don't have a connection with someone, they can feel very lost in the community. So if they have that connection of someone they can call, someone who knows them, knows their child, and they don't feel as lost.
So about 1 in 5 children have a serious mental health challenge of one sort or another. 75% of all adult mental health challenges begin in childhood. So if we want to make a difference, we've got to start early.
Healthy minds form in childhood. Our brains make us who we are. So it's critical that we support how the brains of our children develop.